Hey everyone, if you're getting ready for knee replacement surgery, you might be feeling a mix of excitement and nerves. I'm here to help you get fully prepared so that your surgery and recovery go as smoothly as possible. Hi, it's Steve from MyColdTherapy and Supply Cold Therapy, where we help people get back to living. If you're new here, make sure you click that subscribe button and all the links to everything we mentioned in this video that you can find linked in the description box below. Now let's jump right into it. Step number 2. It's important to consult your healthcare team to ensure a good outcome. You want to undergo a medical evaluation. A pre-surgical evaluation is about having a thorough evaluation from your surgeon and your primary care physician to ensure you are in optimal health for this surgery. This may include blood tests, an EKG, chest x-rays, and other assessments. Also, you want to check your cardiovascular and respiratory health. If you have a history of heart or lung issues, additional testing may be required to ensure your body can handle the stress of surgery and anesthesia. Get your medications reviewed by the doctor. Discuss all current medications with the physician, particularly blood thinners, supplements. Some medications may need to be paused before surgery to reduce the risk of bleeding. If you have allergies or any known allergies, especially particular to metals like nickel, please inform your doctor before the surgery. Some knee implants contain metals like cobalt chromium. It's recommended to get patch tested or tested by an allergist to avoid an allergic reaction. Then there are pre-surgery preparations, like blood donation. Consider donating your blood prior to surgery in case it's needed for a transfusion during or after the procedure. Smoking cessation. If you smoke, quitting before surgery can improve healing and reduce the risk of complications. Smoking affects blood circulation, which is crucial for your recovery. Weight management. Discuss with your doctor whether weight loss would benefit your surgery outcome. Achieving a healthier weight can reduce the stress on your knee and improve your recovery. Now that you're better prepared for knee replacement surgery, we invite you to subscribe to our channel and like our videos. Your support, at no cost to you, helps us continue creating valuable content that assists individuals in returning to an active and fulfilling life. Now please make sure you check out all the videos in this series, and let's get back to living.